Hey, this is Weed. This is a kinesiology career research opportunity. Recreational therapy, it's also known as therapeutic recreation, is a systematic process that utilizes recreation and other activity-based interventions to address the assessed needs of individuals with illnesses and or disabling conditions as a mere means to psychological and physical health, recovery, and well-being. So the educational requirements. It is possible to get an undergraduate degree in recreational therapy. It's also viewed as recreation and leisure studies. And so you can research these different items. I found some opportunities at the University of Wisconsin in Milwaukee and then Eastern Washington University. And you can see some of the required courses are human anatomy, medical and psychiatric terminology, characteristics of illnesses and disabilities, and the use of assistive devices and technologies. And there's usually an internship involved with this academic discipline of kinesiology so that you have hands-on experience working with these varied and diverse groups of individuals. There are certifications that you can earn after you graduate, and the one that I have listed here after having a bachelor's degree in recreational therapy or a kinesiology degree with a concentration in that area, you have to have at least a 560-hour internship that is supervised by someone who is certified therapeutic recreation specialist, and you can pass the NCTRC certification exam by doing the first educational route or also having 5 years of experience. And you need to get continuing education units, that's what CE uses, every 5 years to maintain that certification. There are higher education degrees that you can get both master's and terminal degrees. So I found at Temple University and Indiana University in Bloomington, that's the main IU. And then there's also Clemson University has a PhD in recreational therapy. So for the one program, I can't remember which one it is, maybe it's Clemson, you need to have a 3.0 GPA, 3 letters of recommendation, take the GRE or the MAT scores, be in the 65th percentile or higher on both tests, and then include a goal statement of 500 to 1,000 words to get accepted into the program. For the daily workday for the recreation therapist at the National Institutes of Science, you will see that video at the end of this presentation. There is never a typical day, and then there are some states that have specific requirements, such as California, Washington, New Hampshire, and North Carolina. There are 2 professional organizations, the American Therapeutic Recreation Association and the National Council of Therapeutic Recreation. And each of those have annual conferences that you can attend and interact with other individuals in the profession, make contacts, find out about jobs, etc. Here is a very old Indeed.com job interview. They do not provide a job salary, but they provide some other details. A minimum qualification is a bachelor's degree, and you need to have a CTRS or an NCAP or NAAP certification, which is preferred. Some experience, demonstrated leadership abilities, and be able to serve safe and helping hand certifications. It's full-time. They're looking for a geriatric, which is older individuals, seasoned citizens, and then 1 year of that, and then therapeutic recreation preferred. And you can see where the diagnoses are: traumatic brain injury, spinal cord injury, stroke victims, amputations, adolescents, other neurological and orthotic injuries. So there is the opportunity. Become that person if recreational therapy interests you. These are the references using APA.
My name is Mary Carson. I am a recreation therapist at the National Institutes of Health. Recreation therapy uses recreation and leisure activities as a way of achieving goals for patients. It could be a functional goal, physical, emotional, social. It could be a psychological goal, and it ultimately is to improve their quality of life. Many of the recreation therapists here work with people with very rare diseases that can cause a variety of issues. We have a lot of cancer patients, we have pediatric patients, so we're providing that recreational intervention within the room or even within group activities that we provide throughout the hospital. It's very individualized based on the needs of that patient. The Wii is a great intervention because it can be adapted for so many different skill levels. Anybody who's used it before can tell you can sit down to play, you can stand up. We also will use it if we're working on balance with somebody. Say they've had a stroke and they're having trouble with their balance. We can use it as a way of practicing that balance and get it stronger. I get to play for a living. Even though it's work and I have to be watching for things and measuring things and writing down what the patient's doing and keeping track of it all, in the long run, I'm doing recreational activities as a job. It's pretty cool. With a recreation therapist, there is no such thing as a typical work day. I work varied hours. Each day, I have to keep in mind what time am I coming in, what time am I leaving, so it's fun. I would definitely recommend a career in recreation therapy. You can get up to your doctorate in it. And it's always fun. There's always room to grow, so you get that great basic training in a bachelor's, and you can grow from there.
So that is the end of the presentation. I hope you found it interesting, and if you want to explore more about recreational therapy.